It's gone live.
Yes.
It still says go live, and it's not live. Let me try one more time. Yeah, maybe I have to, I will reschedule it.
I think we're live.
Right, you're live.
Okay, it's not showing on my side anyway.
It did show on ours.
Okay, let's start then. Thank you very much, everybody. Good morning, good afternoon, good evening, wherever you are. Welcome to our show on coronavirus. Your host today, myself, is Moda Woga, and our panelists are Dr. Ferdinand Nali. He is a research scientist, and his interest is in wound healing. We've got Dr. Marcelena, practicing doctor here in the United Kingdom. Later on, we'll be having Mr. Rodrigo Lali, one of our community leaders. Thank you very much. We'll start with a short prayer. Let's pray. God, Heavenly Father, we thank you very much this morning for this opportunity. We thank you for guiding us. We thank you for everything that we are doing, serving your people. Heavenly Father, as we start our show this morning, may you be with us. May you bless it and bless the people who are listening. All this we ask through Christ our Lord. Amen. Okay, thank you very much. I would like to start by apologizing. We had a technical issue, and that's why we are starting very late. But we're very sorry. We hope next time we'll be able to start on time. Our topic this morning is on compliance and behavioral change to public health directives on COVID-19 pandemic. I'm going to ask Ferdinand to introduce this topic to us before we start discussion. Ferdinand, you're welcome. Thank you.
Thank you, Chair. Thank you for inviting me to give the opening remarks for this discussion of today. And also welcome to our audience, and apologies that we couldn't start on time. But certainly this is COVID-19 is going to live with us for a long time. We are all familiar with various directives our governments are giving us in response to this pandemic. And this is our way of keeping in a conversation to help us to keep in touch with at least the spirit of these directives for the best outcome for ourselves, as our families and as individuals. And I think a good way, in my mind, to do this is just to begin with a few definitions which help us contextualize what these public health directives are about. We're talking about infectious diseases, and we live in all parts of the world with infectious diseases. But from a public health perspective, and in as plain and simple language as possible, I want to make a reference to the three categories of diseases that we are always told about. We have diseases that are called endemic, or epidemic, or pandemic. And I think these days we always hear about the pandemic, but it's helpful just to picture what these diseases are when we talk about these diseases. The endemic diseases are diseases that are settled in a population or in a geographical location, and it is known to exist there. And there is no big change of the prevalence, and people live with it. A good example is, for example, malaria. We, in most of Africa, we live with malaria. So these are endemic diseases. And you will have various ways. Some of them have treatments, or not the best treatments, but there'll be a number of ways people have learned to live with it. It becomes a lifestyle of the people in those countries where a disease is endemic. You have the next category of diseases, the epidemics. And you would find from time to time a disease comes and everybody hears about it and worries about it, and governments begin to contain the disease. A good example, for example, is Ebola. Comes and goes, but every time it hits, people are worried how far it will extend. Now, most of these diseases will be contained within a country or within a region. Those are the epidemic diseases. But finally, you get the case of the pandemic disease. The pandemic disease is the one that will spread and travel far and wide through most of the world. That is why the WHO has declared COVID-19 a pandemic, because it is going to travel everywhere. What tends to happen is government then have to step in. And usually in that order, from the endemic to the pandemic, you have diseases people have learned to live with, to the diseases that are new. Now, in the middle, you've got the Ebolas. These are the new and emerging diseases. So they come and go and come and go. But the pandemic is the type of disease that is new. People have very little understanding of it, maybe no treatment. And that is a huge risk to the population. And for those reasons, one of the easiest things that governments do, or one of the first things they do, is to try and have quarantine. The quarantine is often like a public health intervention, which is meant to stop the spread of a disease between jurisdictions, between boundaries, between countries. So in a sense, that is a very good way of starting this conversation, because what do governments do? Governments institute public health interventions, and they may be like the quarantine of 14 days or whichever number of days for specific diseases, because you have to understand the disease enough to decide how many days to quarantine people for. In the case of COVID-19, 14 days happens to be the case. It may be shorter for some, it may be even longer for others. The idea of quarantine is not new. Historically, and even currently, you find that sometimes to move even a pet animal from one country to another, it goes into quarantine because it is a public health disease control measure that is commonly used. So the main thing that governments will do is to try and contain the spread of the disease. They have a quarantine. But within the nation, within communities, whilst quarantine is often a law enforcement thing, it is mandatory, it is done at the border, within the community, there are a couple of other things. One is social distancing, because in a case where the disease is known to spread in the air or through coughs, a little bit of social distancing is important, or an isolation of somebody who is known to have the disease, lest they pass it to the next person. Another thing you do is, like we have here in the UK, for example, this shielding. Because for every disease, once you begin to understand it, you know the people who are very vulnerable. So the social distancing and shielding have a lot to do with who is protecting who. Now, shielding here is often seen as something for the elderly who are very vulnerable to the disease. So they shield themselves from the community, because exposure to the community risks the infection. So you've got a lot of public health interventions. The quarantine, which is often like a law enforcement issue. The social distancing and shielding tend to be more like you self-police yourself. You take care of yourself. You have an understanding. You have respect. So the public health interventions are handed down depending on an understanding of the disease. And for the pandemic, that is the best we've got. But the extreme form of the intervention is the lockdown. Because lockdown essentially is shutting down everything, with the exception of emergencies. So lockdown has huge implications, economically and socially and livelihood-wise. We have had other discussions previously where we dealt with those. But as a public health intervention, lockdown, quarantine, social distancing, and shielding are the things we are faced with. We're all the very different people with different means, with different entry points into the economy, and our livelihoods are so different. So the way we respond to these public health interventions differ a lot, and it depends on who we are. And I like to say two things in that respect. There are many ways we respond, but the first thing is, when the government has decided on an intervention, how do they message? The first thing is the message from the government to the people, to the population. The government sends a message to a people they understand. One of the things you do is, messaging is actually a science in its own right, because you say to people things that you anticipate how they're going to respond to it. So sometimes the messaging, the communication is not, let's say, as accurate or as objective as the truth. So the messaging is not always the truth. The messaging is a way of getting people to behave in a certain way. Let's say you have fear that you have disease. The quarantine time should be scientifically it should be 10 days. Okay, the government may choose to say 14 days to make sure that they are safe. They give a safety message. So the messaging is always a very important part of the response. The messaging comes from the government to the people. The response of the people is another thing altogether. So one example I'll give about the messaging is this. Here in the UK, we started off when COVID was taking hold. The government was ambivalent about whether the population needed to wear masks. Their reasoning was this, at least to my understanding. They were worried that there wasn't enough masks for the healthcare providers in the NHS. Their first worry was, do we have enough masks for the NHS staff? So the message they gave the people was, we're not so sure that you need it, it's not important, and it's not quite. So there was that ambivalence from the government. But their reasoning was they wanted to make sure the available stocks were there for the NHS. You can understand it. But in the end, by 2-3 months, we are all required to wear face masks. Now, if you look at the changing messages, you ask yourself, when were they right? There is no new information about this disease that wasn't available, at least in terms of wearing masks. You know that if something is spread by respiration or in the air, covering your face, it's not rocket science, will help you or will help the other person. So we've had these issues with the messaging. So messaging is one big problem because people respond to messages. Governments anticipate the reaction of people, they can give the wrong message. The next level is the response of the people. Now, this is quite important because from China to Pretoria, let's say, everywhere in the world, people went into lockdown. But you're locking down different people with different attitudes. The first thing I would point out is that the response of the people can be very cultural. If you look at the governments in the Far East and governments in the West, people are so different in how compliant they are, how much respect they have for government and elders, how they would respond to messages. So when China locked down, everybody went, everybody obliged, nobody left their houses. Now, compare with us in the UK, whatever institutions whatever was instituted by way of lockdown, there's always like ways and means. So the compliance differs. So culturally, people are different. So other places they will comply, other places they will struggle. That is the first thing. Now, I take another example. If you were in lockdown, you were in a village in Africa, and you were befallen by a funeral. There are people who have lived all their lives with very strong attachment to rituals about what should be done, because otherwise you got mental health issues. If people are not allowed to perform certain rituals they've lived all their lives wedded to, you may find that people either commit suicide or mental illness. So you have to have that context, the cultural context of responding or complying with public health interventions. The next one is the individual response. Now, you've seen in most countries, there will be people, the odd person, including in the UK here, people who are advising the government, slipping away and disobeying the lockdown rules. Now that has happened everywhere. As individuals, we respond according to our most immediate needs. And there's good examples where some of them have the information that they knew government was advising slightly different to the exact science. So they know it, they behave differently. So as individuals, we actually differ. The next thing is as institutions, we're going to be sending kids back to school. Now there's a whole different level of compliance there. Now you'll get a mixture of children and parents. So the schools and the institutions, it could be like universities, it could be primary schools. The way in which each and every one response will differ according to the type of institution, the age groups, the number of vulnerable people. Is it a care home? Is it a primary school? Is it a nursery or a university? This another level. But there is another interesting one because even in a pandemic, you don't close hospitals. But one of our greatest hopes is that over time we will have, let's say, a vaccine. But you see, we have this immediate situation where you're going to test the vaccine. In countries which control this well, you cannot test the vaccine. You have to go to a country where it is still ravaging the population. And this is something we should be careful about because the way in which government's message and the way population responds, there is something in the middle, a very, very catalyst of the way communication happens these days, social media. You mentioned something like a vaccine in a country which is underdeveloped, but the pharmaceutical is in the West. It's a potent mix. Social media goes wild. There are these vaccine deniers. There are people who always say like that's an exploitation. Exploitation. I've mentioned before. If a vaccine is properly done, I will always take it. But the response of people depends on that as well. We haven't got a vaccine now. If we had a vaccine, a lot of things will change. But we should be very careful that part of that is what is fomented in social media. And in many ways, so you have all these layers of like, we know what these diseases are, we know how this one differs from others. We know the public health interventions, which are government instructions, how people should behave. But you begin by messaging the governments, every president or health minister is giving these daily updates. That is where you begin to ask, how are people going to respond to it? Because people have livelihoods that once it is impacted, they find ways and means around the rules. The other thing is the way in which we respond, the cultures we live in, and whether we are responding as a society, as an individual, as institutions, or as a medical community. But by God, whatever way in which we are responding, it is informed quite a lot by social media. So in many ways, I want us to keep all of this in mind. And our audience would probably be very familiar with how part of this is a form of social media and how we can help ourselves rein in the worst excesses of the messaging. Because if the message is lost, lives are at stake. And I think this is my introduction. I think hopefully I've covered the kind of areas which will be of interest to people, and would certainly respond to any questions that people ask. But that's my contribution.
Oh, thank you so much, Dr. Ferdinand. You've covered a lot of the areas. I was thinking, the government, the type of government plays a great role. So somebody saying China has a dictatorship government, and because of that, people find it much easier to comply because they are being dictated on. And here in the UK, people are free, and because of that, you find compliance takes place very slowly. I think religion also plays a very big role in compliance. I met somebody another time and she said to me, you know what, oxygen is a very poisonous thing. Carbon dioxide is a very poisonous thing. So covering your mouth, so you're breathing back carbon dioxide. So this one is, an intention to kill. This is killing, so they wouldn't wear the mask. So religion also plays a very big role in compliance. Um, so thank you so much for the great introduction. Anybody who would like to come in? You're welcome. Dr. Marcelina?
Wow, that was quite exhaustive. Thank you very much, Dr. Lally. Where do I come in? Compliance is a very, very big topic, isn't it? And indeed, it depends on who you are, whether you want to bend the rules or not. It's quite interesting for you to say that religion plays a role as well. I wonder in what sense. I thought somebody who is already wearing something covering themselves already will find it easier to comply. But again, not everybody does that. So I wouldn't know. The cultural thing, yes, people will try and fight because maybe they will associate face covering with certain cultures or certain way of dressing. I don't know. In the case of China, would you say it is the communist governance whereby everybody will obey because the rules are rigid? You either do this or you don't do that, and therefore people tend to comply. I don't know, but it's been difficult in this country. I've walked about. All of a sudden, if we come to the face covering, all of a sudden, almost everybody's got some form of medical condition, which is not allowing them to cover their faces. And in the hospital where I work, Sometimes you've got to go and examine somebody, and the rooms are quite tight, very small room. You've got maybe two bodies or three bodies in there, and you're asking somebody to cover their face. They'll say, "Oh, I've got asthma or I've got medical problems." So where do you stand? I mean, where do you draw the line? It's quite difficult. And who are you to challenge anyway? Who are you to challenge? And sometimes you clearly know that you took a history from this person. They didn't tell you any past medical history of asthma or other medical conditions. So sometimes I just stand there, or sit there and look, and I just shake my head. I mean, what do you do? This is human behavior. They will always find something to fight about. I find the most difficult part about this social distancing as well comes when it comes to maybe socializing and relationship. Do people respect that? I doubt it. So there's been a lot of breaking of the rules, but it's so subtle, and it's so difficult for the police to for the the government or the authority to police this. Is the moral obligation that we have to see us through as to how we keep this. Because I work in a department whereby I see lots of people who come, and from the history I take, it clearly tells you there hasn't been any social distancing when I take the history and hear what people tell me. So, is it the youngsters alone, or is it everybody? I think the rule, in a nutshell, have not been obeyed because people, for I can't say for petty reasons, but because it's a new phenomenon on board. We've not been in this situation before. It's not been a week, it's not been 2 weeks, it's been several weeks. People have become fatigued from this social distancing. And so, to some degree, it's lost a meaning. It's lost its meaning. And if you want to know whether this has been true or not, you may need to go to maybe public health England and look at the trend of diseases that are coming up, which are the acute diseases that have risen up. Because then you'll wonder how maybe has, for example, gonorrhea gone up or chlamydia gone up, this kind of thing. Because if you lock down, how come new cases have come up? Where are these things coming up from? So there are these kind of things. In terms of traveling, if I want to take it to maybe my African continent, I wonder how the lockdown would really happen, because to me those borders are fluid. Even though there's a physical border barrier with authority, does that always work? That's really a thought for anybody to look at, because I'm sure people have seen through those borders. Now, whether that is something to look at or not is for the government to find out. And again, looking at the attitude of people, when Corona was at its prime in my country, what did people say? Anecdotally, I was told the the average South Sudanese will say, "Oh, this is the disease of the rich." So when there's funeral, people come in their numbers. When there is anything, they mingle, they do all sorts of things because this is not their disease. So the social distancing is out of window. The face covering is not something they respect, and therefore the attitude of the people does not help the compliance. And that is, I think, where the government should have stepped in first. Public health um, should have some form of educating the public, health advising and campaigning first or more as these measures are put on board to be able to help the average person maintain what the government has put in place. I'll stop here. Maybe Rodrigo or Lali can add on that. But it's been a wonderful, wonderful presentation. to give us some insights.
Yes. Rodrigo, do you have any, yeah, anything? Yeah.
Yeah, thank you. I'm sorry to have joined you guys late because of some unavoidable circumstances. It's an interesting topic about compliance and behavioral change. Dr. Ferdinand Nally clearly gave a lot of views in various perspectives in relation to very many countries and made a lot of comparisons. But realistically, it's a little bit very, very tricky when you come to compliance regarding rules in relation to the present COVID situation. For example, Doctor talked about wearing the face masks. In my own personal interactions within our local community, sometimes it raises that question as to whether really the use of face mask is something really good, because it's good, but the way it's being used, I've come across uh, even older people. I would actually call it misusing the face mask. For example, dropping it down, one will wrap it and use it for for clear, for for wiping the face and putting it
I
back.
need it right now.
uh, Climate. I was like, are we making matters worse? My personal experience about the use of face mask. Each time I put on the face mask, because sometimes I use my my eyeglasses, I find that I feel very uncomfortable. It is like an on and off sort of thing, and you find that you touch it quite often, and eventually it gets dirty. So the question is really, are we the right thing in the right way? Just like I would say we are in a different world and we are trying to look at things differently. The use of face mask and keeping safe in relation to COVID is a new phenomena which we need to learn. I can easily tell that it can be learned simply because I have had interactions with my within my neighborhood and the children. In the past, those children, each time they see me, they will want to run and give me a hug. But interestingly, this time you can tell the distance the kids are trying to keep. So what I'm trying to say is that um, response to compliance and behavioral change has got a lot to do with reflect action. Oftentimes we find ourselves acting subconsciously. You find that you have done something which you do not ought to do in relation to keeping safe. But what I'm trying to say here is that I will believe with time we shall learn how to respond to some of these, behaviors of ways of keeping safe and compliance in relation to the guiding rules. Doctor talked about the Chinese ways of coping up. I think I agree with Dr. Marcelina. I would imagine the way Chinese respond to their government pronouncement in relation to lockdown and keeping safe. They had a long history of compliance. I would imagine, I'm not saying so, but I would imagine it has got something to do between being sentenced or between serving a sentence if you don't comply. But if you look back to our countries, a good example of what is happening in Uganda and maybe East Africa, or maybe developing countries, you talk about COVID-19 as of now. Some people might even imagine, what is this person talking about? It is like the impact is not grossly felt. Even within the UK, there are people whom I would really tell that they have never ever complied with the government rules. I would call they are actually people in the streets. Imagine people walking in the streets, spitting salivas all over, and they're sleeping in those streets. Yesterday, when I was moving around, I came across some of them, and they're very healthy. Now, how would you draw that comparison to some people who are trying to be, in a very clean environment, and yet they are more vulnerable and they have had COVID, and some of them passed away. So you can see the complexity of all this. Let me talk about religion. A few days ago, I had, chats with various people, including nurses, but somehow I was a little bit disappointed to the fact that there is a high level of attributing COVID to religion and God's plan. It is like it's all about God guiding us. It's like we are leaving it to God. We have to pray. It's like however much you may try to protect yourself, it is all up to God to. It is like this God keeping us safe, but not ourselves. So I was like, I think that is not good enough. So what I'm trying to say here is really, I think we need to give a little bit of time, and we should continue talking about compliance and behavioral change, which I strongly believe will definitely come with time. I have overheard certain countries enforcing compliance by various means, people being beaten up, in trying to enforce safety in the process. There are people who even lost their lives. When it came to the lockdown, much as the ultimate aim of locking down was a good one, but it led to so many death cases, like one's inability to access care in various areas in relation to where we come from. So you can clearly tell that even here in the UK, the government is finding it very, very difficult to enforce the compliance, because it is becoming like more or less a human right issue. It is like, I have got the right to be where they are. And it's also dependent on the nature of different places. Like, for example, the weather here in the UK. It is like it confines people into indoor activity. But again, if you look at this current warm weather, it becomes like it is a need to get out and have warmth and socialize. But it is like if you are prevented from being where you are, it becomes like as if your right is being infringed on. So I really agree with both discussants of their views, but I think that is what I believe I can add on to.
Yeah.
Can I just imagine quickly before Freedom say something? I'm sure you've got a lot to say after the both of us have spoken. Rodrigo, perhaps when science is still being awaited on to bring an answer to COVID or any other disease, the best refuge you find is in God, isn't it? Isn't that why these people believe, God will have an answer, or it's God's way? I think anything which is a mystery that we don't understand, people find consolence in God. That's by and by. But can I just ask you something personal? How do you wear your mask, if I may ask, or face covering?
Oh,
Which is a bother to you?
I wish I left my mask in the car.
Just show me. Are you the people? Just show me that hand. Are you the people that wear it here or here?
I think it's both the nose and the mouth. And honestly, that makes me feel very uncomfortable, especially whenever I'm driving or whenever I am outdoors. It is like the air I breathe is confined between, between my nose. Of course, definitely, like I don't breathe through my eyes. I breathe through my nose and mouth. If the two are limited, definitely you feel very uncomfortable. So oftentimes I am forced to push a little bit down or maybe a little bit up. And how do where you
Exactly.
and Magdalena?
I was waiting to hear that. I have one. If I had the time, I'll go and bring it. If I have, give me a minute, I'll go and get it before the end of this. Yes, I do wear it there. You need to pinch it a bit. When you pinch it, if you wear the surgical one, it does allow you to breathe. But again, you need to have one perhaps measured so that you can fit your face properly. Maybe my African face and nose is a bit too wide for these things, I don't know. But you can have them measured so that they fit nicely. The problem I have with people are exactly the people you talked about that wear them there, or they may wear them sitting there if it fits the purpose.
But to answer the question about religion, I think it's even God will appreciate if you are trying to do your utmost to prevent yourself from
Yes.
from being safe. But I
Yes.
find it a little bit weird when people would say, let's leave it all up to God to guide us. It is like finding a lion, a hungry lion coming towards you, instead of trying to save yourself from running away from it. It's like you kneel down and you begin to pray that, please, God, save me in this situation. I would agree. Well, let's put God in whatever we do. At the same time, let's keep saving ourselves. That's what I would
Yes,
really
I
think.
think I think they do that, and then they give the rest to God. Yeah. Thank
Yeah.
you. Yeah, I think so.
Okay.
So, for example,
Before Rosemary,
I'll
before
very
you go
quickly run and get one.
okay. Before I give the chance to Rosemary, I'd
Yeah.
like to say that I'd like to say that indeed, even me, I wanted to find out from doctor. I find these face masks very uncomfortable, and I cannot breathe in. As soon as I put it on myself, I go out of breath. I don't know why. Maybe it's more psychological. Maybe I need it to be introduced to me gradually. But I find it so difficult to breathe in it. So I rather not have it. It's not that I don't want to comply, but it's because I find it very uncomfortable. I'm out of breath. And reading also that some people, they have even fainted, for having these face masks on because they cannot breathe in it. So they fainted. So, doctor, I wanted to find out, some people, when they put the mask on, they have fainted even because they go out of oxygen. And I'm also thinking, is there no long-term effect of this face mask on people? Because many people don't know how to wear it correctly. And when I put it on, I even don't know where I can breathe from because it covers it completely. So I'm so worried about the long-term effect of these masks on me. Before I give the chance, I'd like to say that we today we started late. This to our audience, and we'll finish 15 minutes late. So you bear with us. I beg you to bear with us. Thank you. Okay, go on, Ferdinand.
A couple of comments just to capture what Marcelina and Rodrigo were saying. First one is probably a little bit of a joke. I think all the people who go and pray to God and expect God to save them from COVID are, I think, missing one trick, because I think there's a joke about people who pray to God to win the national lottery and they forgot to buy the ticket. So at least buy the ticket, then you can go and pray to God. So that was the example I wanted to give away. But another thing is, I think Rodrigo made a good point about mask hygiene, about the way people use it. They will use it to mop their face and then they wear it back and all of that. Now we should be very mindful that the mask is essentially something that came out of theater. It's used mainly by healthcare professionals. There is a particular way in which you wear it, and there is a period after which it's kind of spent, you dispose of it. Now, when we are in a situation where people are strict, people are required to wear, And many people actually probably don't want to wear it for a whole number of reasons, including the one the chair was just mentioning. People feel uncomfortable. And I say we all are a bit like that. I am too. Are comfortable in the mask. But one thing to remember is that, as you, one of the times when you must, when you're traveling out and about, you can go without a mask. When you're getting on a train, in this case here, you have to wear it because you're close to other people. So when you need the mask is when you're too close to exercise social distancing. So when people remember that, actually that is one pressure taken away. The second thing is when you wear the mask, try and breathe normally, because I know I've been there. I've possibly on one occasion hyperventilated just because I feel the discomfort, and then you try and breathe harder. The most important thing is to remember to breathe normally, because it just helps. Now, if you think about the time we go on flights and you're given those instructions in case of an incident and the oxygen masks drop down, they advise you to breathe normally. And it's very important that in all the discomfort we have, try and breathe normally because it helps. Now, when you use a mask and you are required to use a mask, because behavioral change, what do people do? People follow the letter of the law to wear a mask, but not the spirit. So somebody may carry one mask in their pocket for a whole week and use that. Whatever damage or danger that is to themselves or the others, it doesn't matter, because they're following the letter of the law, not the spirit. There are many people who come on these trains these days, I realize, and that's really upsetting too. I go back to the example Marcelina was giving, the people who don't comply, because we have a liberal society with exemptions, even for wearing masks. But I give you this example. I give you two examples. One, a group of teenagers, all six of them, hop on a bus, none of them wearing a mask, laughing their heads off, chatting away. Really? Could they all qualify for exemption? Because you self-exempt, you self-certify that you're exempted because you've got this asthma, that condition. But the thing is, by the letter, you cannot say they're not. But you know in your heart, this lot, they need to be toughed out of. They couldn't do that in Wuhan. They couldn't do that in China. In this society, unfortunately, that happens. The other example is somebody is on the train and they're not wearing a mask, but they spend the whole ride on the train, 15 minutes or thereabout, heavy on the phone, talking aloud. And at one point, they thought they missed their stop. They hop up, look at the line, the stops, and starts asking everybody on the train. I had no interest in helping him where he was on the train. He spent all of that time talking. My feeling is this: if somebody is genuinely exempting because of a medical condition, they better keep their mouth shut. The law should extend to the fact that if you are exempting, you should keep quiet. You should not go on the phone or any of it. So those are the kind of things we struggle with. Now the other one is the religion. Now, the joke aside, the church is one of the places where it is hardest to keep social distancing. So the reason why we don't go to church this time is because it's difficult to keep social distancing. And also, in many ways, actually, if I was in the church hierarchy, I would probably celebrate this. We attended a lot of masses online at home. Do you know what? There are days when you don't make it to church because it's too far, you left things late. At home, online, we always attended mass. In fact, we went to the extent of going to various churches in different parts of the world, which was a wonderful experience. I thought it was quite enriching. And I would like that even when people go back to church, that option remains. You think of all the people who are infirm, unable to travel, so they will always have mass at home. So in some ways, actually, this wasn't such a bad thing spiritually. The important thing that church should do is the messaging they give. People should not be deluded in this thinking that it's all up to God. No, it's not all up to God, and you don't reach God by going to church. You can be online, you can have a wonderful service, and those are things that the church should actually reinforce. And it extends the reach of the church by giving services online. And in many ways, actually, also I think about the different societies. We have a good example of China, where we think the government is strict, and when the government says something, people obey. But it's not only the government, but culturally, they are actually a very obliging society. And apart from the government, the elders will say something, they will obey. I find a very interesting comparison among, for example, the Japanese society. Japanese society is a very, shall I say, soft-spoken society. I can't find the right form of words, but in many ways in the West, if you want something, if you haven't said it, nobody believes you want it. There are other societies.
What about our society? I'm sorry to keep interrupting, but what about our society back home?
No, I'll come to that. So there are other societies like that where you have to be in your place. You know your place, and only a hint has to be dropped, and everybody falls in line. We're somewhere in between. We are actually, to one extent, a very obliging society where parents tell you something, you do it. Now, those of us who live out in the West know we've lived the both worlds, and something we miss about the kind of parenting at home which we cannot execute here. So we're somewhere in between, and in many ways that makes us a lot more, I don't know, argumentative or whatever. But we are somewhere in between, and I think we need to know where that kind of parenting, that kind of rule of law and discipline in society is for the common good, and we should try and reinforce it. We could go easy in certain things, but we should be a little more forceful to enforce certain things that are for common good. And in many ways, that is done through the church, that's done through schools, but good old-fashioned parenting is the bedrock, I would say, of our societies, our communities. And in many ways, the examples we're discussing here, these are the sort of things like if your parent told you, you go and behave like this, you do it. Here, it's non-existent. That's why we get those problems in the trains and the buses. And that's my contribution.
Yeah. Interestingly, I put my hands in my pocket and I found my mask. I wanted to show Marcelina how I use it. So this is the kind of mask I have.
Excellent.
And it is made in such a way that it is a double cloth. And I try to wash it after use.
Yeah.
And I normally put it like this. And you can see, each time I try to breathe, you can see how Dr. Lally was talking about breathing normally. So you can see how it reacts when I try to breathe normally.
Put it back on and talk. Demonstrate whilst you're talking.
You can see how uncomfortable it feels.
We will see.
You see?
Mm-hmm.
Each time I try to breathe normally,
leave it on while you're talking because you're here to demonstrate to us.
Each time I try to speak
leave it on while you're talking to us so we see your problem.
In fact, this is actually a problem when you cover your mouth.
Also, that we can hear you.
Yeah. So you can see how hard it is to continue using it. I feel more comfortable when I am off as compared to when it's on. But like I was saying, with the time, one can get used to, just like putting on glasses. You know, when you start using glasses for the first time, you can see the discomfort. But I strongly believe with the time, we shall get used to it.
So you're using it to puff up your beard? Yes, the one you have doesn't need much to wear. But if you're using the surgical one or the hospital one, which I have here, this is the one, the ones you buy in a pack. So there is two sides to it. There is the blue side and there is the white side. The blue side is supposed to be on the outside and the white side is supposed to be on the inside. And there's a tiny metal. That metal bit is supposed to sit at the top. So this is how I wear it. And when you're handling it, when you take them from the pack, the white top is on the bottom. So you're picking them from the top. So now when I pick it, I try to use it, touch it as minimum as I can. So I've picked it. I'm going to put it on my face. You know, once I've put it, I adjust it. So I pull that down and then I pinch it a tiny bit there so that it gives me that sort of room so I can breathe with it. So I've now adjusted it and that's my mask. And I have it on, I'm talking. Because of this sort of folding here, it allows me the chance to talk. Indeed, it's difficult to be in it. But people have a lot of anxiety about these things. You have to calm down in your head. You have to know that it's the norm. It's not going away. Imagine the doctors that wear those things as if they're going to the moon. They've got the mask, they've got the shield, and then they wear that other suit on the body to prevent this corona. So imagine them in those things. How do they breathe? They sweat a bucket to see patients. They're doing it. So the government or the system is asking the bare minimum from you to protect you from us and us from you. So it's doable. And this is what we are doing every day in, day out when we're seeing patients. It can be done if you wear it properly. Because I've pinched it here a bit, it gives me room. And because of this sort of folding here, I can breathe. Yeah, it does make some, expand and or deflate, inflate, but it can maneuver. I can talk freely and I can use it. If I have to reuse it, I touch it from there usually. And what I do this. I fold it that way. Remember, I touch minimum. I just do that.
We can't see it.
This.
Lift
Oh,
it up.
sorry.
We can't see it.
Yeah.
Yeah. So if I have to do it, I use it again. That's all I will do. I touch the sides only, even one side, and then I fold it like that. And I put it sort of down. If I have to use it again, I'm going to touch the sides, open it up, and put it on my face. And when I'm storing it, I'm going to put it on a desk, on a clean desk, face up, because that goes on my face. I don't put it downwards. I leave it up. I put it there, but that's going to be temporary. If I want to put it in my pocket, that's how I've folded it. The one that's gone on my face, I folded it inward. So that way, whether I'm going to do this or what, the part that's going to go on my face is inward. So nothing on the outside is touching it. I've got a cloth one which I've made because according to some research, they're saying cotton, if the virus lands on the cotton, it does not have room to survive there. It's black. So I've made a cloth one myself. It doesn't even need machine for stitching. I don't know whether you can see it. I stitched this myself and I just bought elastic thing. So it's very easy to make what I've made. Because it's double layered, yes, this one is a bit difficult to breathe in, but I wash it every time and put it back. I've made it double layer. Perhaps what I may do next time, if I'm making another one, I'll make it single layer. Because it's cotton, it's a bit difficult to breathe in it. But I'm imagining in winter, this will be comfortable. So again, I wear it. I just pull this down. Because of the sort of creases I have here, the pleat, it allows me some breathing because it allows me room to talk. So if you look at me now, I can talk, I can maneuver, I have room to talk. This one, yes, sometimes I feel it's a bit uncomfortable compared to the surgical one, but that's how you wear them. But because I'm learning how to make it, this is the first one I made. With time, I may get better. So this is just to show you how to wear them.
I've got a question for Dr. Marcelina.
Yeah.
We breathe in oxygen and out.
Yeah.
And do what?
We inhale oxygen.
Yes.
Out. It is like breathing in and out. How will that mixture of the two within the mask make an individual feel?
When
And
you breathe,
and I'm saying this because try to imagine how you are going to limit the oxygen you inhale. So it is like confined within a short period of time, which can easily cause a problem. I remember in someone who is believed to have had an accident because the lack of intake of oxygen was lacking, and he developed a problem while he was driving. So you can see the amount of limit. And then also the safety. Somebody was advocating for the particular mask you demonstrated, saying that at the end sides, there is a bigger gap, which may make it to become unsafe. Someone was saying, it's good to tighten it to make sure that, so all this is like, a distortion of how best.
Yeah, but the reason you're pinching it, when you inhale, you're taking in oxygen, you're bringing out carbon dioxide. Because the thing is not so completely tight, there is room for that air to go out. Yes, if you've got breathing problems such as COPD, obstructive airway disease, you may already have low oxygen level, and therefore having that mask on you, you may even take less. That is why those people will say, "Oh, I've got issues. Wearing these masks is going to cause me more problem," and they don't wear it. But a healthy person shouldn't have that much problem. And in any case, if you're doing a marathon running or doing your exercise in the air or you're walking the streets, there shouldn't be any reason why you're wearing the mask. The mask is needed for certain designated area at a certain time. If you are the type of person who feels it's going to confine you, it's going to make your breathing difficult, or you've got that anxiety.
Well, speaking on
The
behalf
person who has
of our
asthma
people
very
back
likely
home,
with other issues.
Okay.
speaking on behalf of our people back home, you try to let's put ourselves in a situation whereby the environment is very, very hot back home and very dusty, and we are to use the masks. How would you imagine someone would feel like, and how difficult it will be with that environment where someone is sweating and you find that on one side of the pocket you have your normal handkerchief for wiping your face, and then you remove you put it also there, and then you find yourself using the same. Try to imagine how hard it will be.
So now, yes, how would you imagine catching the corona and dealing with the sweat? Don't you see people wearing ties in that country, and they're sweating within their shirts?
It is a very difficult. It's very difficult, you know.
You have to strike a balance.
Also, I have a question.
I would make a comment.
I have a question.
Yeah, Lali, yes, Ferdinand,
Let me make this comment, Rodriguez. If I'm in a dusty bus ride, whatever, on the road, actually the mask might even help. In many ways, the idea that when you're wearing a mask, you will not have enough oxygen, or you will faint. There is a logic that you might have not the same amount of oxygen because the carbon dioxide you breathe out is still hanging around there. But you think about this: every time you breathe in, you're breathing air, which has got all the oxygen your body will ever get. When you're breathing out, you're breathing out mainly carbon dioxide. But in that short space of time, there was that gas exchange in your system. It takes the body no time to upload the oxygen you breathe in into your blood system. In the same way, when you breathe out, the carbon dioxide diffuses out quickly. So there is this very efficient exchange of the gases because there's enough holes both through the mask and through the sides. So like Marcelina was telling us, you pinch it, but there's still enough holes. As you breathe out, actually, the carbon dioxide will go out, the gases will emit very quickly. It is true that most of us, because just didn't want to have to wear this mask, by the time you're wearing it, you're already anxious. And to be honest, sometimes when you feel that initial resistance to your breathing, you probably start to breathe even harder. And the easy thing is you can even start hyperventilating. So a lot of it is the psychology of wearing a mask. We really, really need to try and calm down. And you feel for the surgeons who will wear it throughout the day. They're in theater. And you can think of these people who actually come home are normal like us. You begin to accept that, you know what, if I have to, maybe I should just learn to tolerate it. Try to calm out about it, because I think people find this opportunity on social media to say, yes, you'll be hypoxic, this and that. No, the body works well. You think of a sprinter, people who run 100 meters. You know, by the time they finish their 100 meters, their body is so full of lactic acid because the metabolism is too fast for you to have enough of the normal way in which you will burn those energy resources. So in many ways, the body can cope with these things. But if we throw in social media, throw some of this pseudoscience, people get really scared. And it's true, it's uncomfortable, but you know what? The body will adapt and cope with it, especially if we pass out the best messages. Now, it's hard to tell children, for example, to wear a mask. That is why they're exempt. But in many ways, actually, adults are better able to psychologically, mentally cope and settle themselves to wearing something like that. And it's very important that where we should, we use it.
Hmm. Yeah, thank you so much. I wanted to ask Dr. one question. We're now coming close to the end of our show this morning, but I have a question. Somebody was, when they came closer to me, this social distancing thing, they said, hold your breath, hold your breath. If you hold your breath and I hold mine, you won't get the disease. You won't get, you won't catch corona, even if I had it or you had it. How does that work? Holding on somebody's breath.
I entirely agree with that because I actually do practice that. If I'm walking on the pavement and there is somebody jogging,
Yeah,
I know that in that split second, somebody who is jogging is breathing very hard. If they have got
yeah.
COVID, they could breathe in your face. And for that split second that they're going past you, because you're probably within half a meter or less, just hold your breath for 1 second. It's a bit like using a mask to block what is coming from somebody. So it's just kind of common sense thing. You can do it, but I'm not advocating that people go holding their breath walking down the streets. No, but actually, if you think about it, that split second somebody's running, you don't know who they are, you know they're breathing hard. You know what? You can hold your breath, if especially if you're on the wrong side of the wind. That's common
Oh,
sense.
okay, thank you. Thank you so much.
Yeah.
Okay.
Before we conclude that, I think it's good to look at the views of the or the comments. I've just quickly glanced here, and somebody said they thought this is Madi. Oh, we should be talking in Madi. And somebody also answered. They said no, because this is perhaps something for everybody. An interesting one here is for Rodrigo. Somebody agrees with you. I'll read. I agree with you, Rodrigo. God is totally out of this, and in fact, he has miserably failed us. Let's forget him and do infection
Thank
control.
you.
He
Ah, so anyway, I was laughing
also said, wearing face mask makes one to poison themselves with carbon dioxide, which is dangerous to the immune system. It actually causes severe acute and chronic respiratory disease. I hope we've managed to answer you, sir or madam. Yeah? So I thought I should bring it to your attention just in
at.
case
Sorry,
they think you
That,
got
that
them.
was really good. I was just laughing at when Dr. Lally said, when you're on the right side of the wind. now,
because the wind is blowing one way, which you
how,
know.
anyway, it's okay.
So everything coming from one person is blown in
okay.
your face. It's
Yeah.
maybe I'm being over analytical about it, but it's a good logic.
Okay. So thank you very much. I just want to give each one of you chance, to give us one message that you want us to take away. If we could start with you, Rodrigo, what's the message you want someone to go away with this morning?
Thank you. I would simply say compliance and behavioral change.
I'll give you a call later. Okay, cheers.
Compliance and behavioral change should be adhered to. I know it is quite difficult, but with time, we shall get used to it, and we should continue practicing it, and we should continue using face masks safely because COVID is real.
Hmm. Dr. Ferdinand, the
I will
message
be
you want
very,
us, yeah.
yeah, I'll be very brief, but I think we've had a good discussion. We could go on for a while, but the important thing is that we've got governments in place, we've got public health interventions, which is science based. But by God, people will behave depending on who they are. Be mindful that the public health directives will be responded to or interpreted in terms of the culture of the people and their livelihoods. How it impacts on their livelihoods will be a big part of how they choose to respond to it. And once you put that face to face, people are not stupid. They will always find ways and means around any regulation to protect themselves to have a livelihood. So that is if you in government or as a community leader, those are always the things to try and bring to bear on people who try to implement or enforce these regulations. And that will be the best outcome. You have to think of people in terms of livelihoods and their cultures in response to this pandemic.
Mm. Thank you. Dr. Massimino?
Yes. What I'd like to tell people or every listener, I would say thank you very much for being patient and attentive to us. The first and foremost thing is I would like to advise each and every one of you to take control of your health. Be safe. Do what you think is relevant to keep you safe. Let us be compliant to what has been handed out to us in each and every way we can. Let us be open to learning new things and new ways to adopt it to suit us, because this is something that's not going away today or tomorrow, and therefore we need to find ways to keep healthy. And
Mm.
that collectively we can all live safely.
Mm.
Thank you.
Thank you so much. For me, the message is every day is a learning, opportunity. So don't miss out when there's opportunity to learn. Learn. Like for me today, I took something with me, and I'm sure you too. So my message is try to learn, and everybody is learning. COVID-19 is a new disease, and there's nobody who has had an experience of it before. We are all learning about it. So don't lag behind. When there is chance to learn, take that opportunity. Thank you very much for being with us this morning, this afternoon, wherever you are. See you all again in 2 weeks' time. Thank you. Bye bye.
Bye bye. Bye bye.
Bye-bye.
Mod dog, are we still live or you've put it off?
We're still live. We're still live.
Yeah, it's slow. I'm trying to end it, and broadcast is not ending. I'm sorry, bear with me. Is it still live?
It reads
On my
live.
side, yeah,
On our screen, it's still live.
yeah, it's still live. I don't know. It's
Maybe we can log off and log on again.
we are not. Okay. Okay. Let's log out.
Yeah, okay. I will.